Welcome back to Truth to Tell. I'm Michelle Alimoradi.
And I'm Andy Driscoll.
What'd you say? I'm what? I'm in trouble. Well, thank you, officer, for letting me know that I'm in trouble. Come on, man. You gotta be kidding me. Like I wet the bed or something? Man, don't give me that. Like I stole your donut. Man, you don't know what trouble is. Trouble is you got something growing in you, eating you out from the inside. Okay? Trouble is coming home, 12-hour grind from the shop, and the bank has put your bed and your couch on the front lawn. This supposed to be trouble? What? Sitting here in a room with you? Or what? Sitting in the slammer? Getting 3 squares a day, and the doctor, he got to take care of me if I get sick? That's supposed to be trouble. Nah, man, that is trouble's over, man. Don't bother playing your little mind game with me. I got nothing to hide. I'm going to put it right on the table, what I done. But if you want me to cooperate, you're going to get the whole story. Yeah, you might have to turn it over and right on the back there, because I'm not going to let you put my wife into one of them little paragraphs. Okay? So where were we? Oh, yeah, the cancer. Round 1. So, doctor says that we got to operate right away, and then the chemo. And this is coming, you got to understand, right on the heels of me buying into the auto shop, right? Partners with my buddies. So all my cash, it's wrapped up into that, and there's no way to get it back quick. I mean, the insurance, it's gonna cover the treatment, but the out-of-pocket, well, my pockets, they just aren't that deep. So, doctor says, we can get it, just cutting the affected area out. It's a partial mastectomy at this point, so we go in, and yeah, it's a nightmare. But it don't end when she comes home. I mean, the bills that are coming back, they're almost as scary as the surgery. The first one, it's like $14,000, and we still got coverage at this point. We're not even into the chemo yet, so I put the house on the market, just to see what we could get, because we bought bigger than we needed, because we were thinking about starting we were thinking about starting a family, but with the chemo and the bills coming. Anyway, seemed like a miracle when less than a month we found a buyer. Of course, we didn't find a new place yet, so we just rented a room at the Redneck Riviera. Yeah, trailer park. That's not the best place to be doing treatment with the Jerry Springer circus going on 24/7, but we hung in there. We found a nice place with an extra bed. We're still thinking about bringing in a kid at this point. It was nuts at the time, man. I wasn't thinking straight. I wouldn't got in a mortgage like that. But, I should have put more down for fixed interest, right? But I wanted to keep the cash flow going. Anyway. And the guy who sold me the mortgage, he actually worked up some tears when we told him what was going on. Oh, yeah, don't worry about it. His voice cracking like he cared. Anyway. That's what we did. So anyway, when that housing bubble burst, we end up holding on to this mortgage. The payment ends up 40% more on the smaller house that was supposed to save us money. I don't know what I'd have done if I'd have found that guy. He took off down to Florida, probably bought himself a new big McMansion that he found a good angle on. Don't know what I'd have done with that guy. I definitely would have given you some more forms.
We welcome you all to this rather special edition of Truth to Tell, which will feature a couple of cuttings from the powerful play Mercy Killers, created and performed by Michael Milligan in venues all across the country, prodding a public possibly confused about the troubles that can descend on the most confident of families, and that they can make it on their own when healthcare catastrophe visits them. We thank Michael Milligan for his willing to appear this morning to give listeners and viewers a taste of this production, which will highlight the annual summer celebration that Healthcare for All Minnesota, HCA Minnesota, and Physicians for a National Health Plan Minnesota, or PNHP, this year from the stage of the Chanhassen Dinner Theatre this coming Thursday evening, June 20th. We'll hear quite a bit more about that program and another piece of Michael's play in a little bit. But right now we want to talk about why single-payer advocates persist in the face of upcoming coverages under the Affordable Health Care Act, or Obamacare if you wish. With its introduction in 2010, the Affordable Care Act, or ACA, popularly known as Obamacare, single-payer coverage advocates indeed might have pulled in their horns with the coming 2014 implementation of that law that would appear at least to cover everyone, well, except for maybe 9% of the public or something. And we'll hear more about why it's not going to do the job. At some reasonable cost, Minsure, or Minsure, I don't know how they say it these days, excuse me, Minnesota's version of the mandated health care coverage of the health insurance exchanges is supposed to fill coverage gaps for those willing or unwilling or unable to secure coverage in the more traditional fashion, and that is like employer-based health care or medical assistance or what have you.
But will that be enough to narrow the chasm between full coverage for oneself and one's family and those forced to visit emergency rooms where the law requires care and treatment? HCA-MN, or is that how you say it? Just spell out the letters there. And Physicians for a National Health Care Plan Minnesota reply thusly: the federal reforms are a positive step that will provide coverage to many of the uninsured, but they do little to control the costs for those who already have insurance, and the skyrocketing cost of health care must be addressed. By delivering health care in an efficient, common-sense manner, the MHP will make health care affordable to all.
By MHP, HCA Minnesota and PNHP are referring to the Minnesota Health Plan, an alternative to the ACA's health insurance exchanges and Minsure. You'll get used to that name. That name will be heard over and over again now. Proposed as a system to cover everyone, leaving out no one and doing it all for less money, according to the proponents. But that mandated coverage would be purchased under pain of penalty tax.
A few months ago, Truth to Tell's Community Connection series brought you a 1-hour special broadcast from the Wilder Foundation featuring advocates and arguments in favor of Minnesota's then pending legislation to create its own version of the federally mandated health insurance exchange. And this became Minsure, as we've mentioned now a few times. Some states have created their own exchanges and some refuse to, meaning the feds will step in and run a system allowing those without employer-based insurance or medical assistance to purchase some sort of plan. Part of this is an offer to increase Medicaid payments to those states willing to accept it and chip in.
PNHP appeared on that show in support of the plan, but stressed that the real answer to universal coverage at a minimal or no cost to patients while lowering skyrocketing costs of health care, period, is, in fact, a single-payer system. Now, this may have your head spinning and about the myriad mandates and options under Obamacare and the state's role in all of this and why it simply isn't enough for those who have looked for complete universality of coverage in much the same manner as our Canadian and European allies provide.
So now it's time to talk with some of those who have stuck to their guns in a push for a single-payer plan. Remember, we're streaming live video today, and now, as we do every week, with videographer Craig Stellmacher, who's standing there behind the camera, and you'll find our live show up on livestream.com/truthtotellmn, And that's, again, livestream.com/truth-to-tell-MN. And then you can also still catch the audio on KFAI.org. Also on your app on your phone. Like, we have to plug that really
Yes,
quick.
that's right. We can tell them now that
KFAI now has mobile apps for both Apple and Android systems, so you can
and
download
iPads.
that. And
Yeah.
well, that's the
iPhone,
same.
iPad. I see what you're saying. Okay.
iPad and iPhone are the
yeah.
same store, but in your app store you can look it up. I think it's called KFAI Public Radio App or something.
I think that's right.
And it's really great. So you can listen to us live. You can also listen to past shows there. It's brand new, so be one of the first to check it out.
Yep. And or watch us at livestream.com/truth-to-tell-min, which is important, by the way.
You can't see the video on the app yet.
Not yet. We're working on it.
And as always, every week we want you to join the conversation, so you can give us a call at 612-341-0980 if you're local. That's 612-341-0980. You can also, if you're not local, if you're listening to us from across the globe, you can tweet or post your comments on Facebook. On Facebook, it's facebook.com/truth-to-tell.
That's it.
And on Twitter, you can tweet us at Driscoll, and I'll be monitoring that throughout the hour. So please do join the conversation any way that you can.
First, we want to welcome back Senator John Marty, State Senator John Marty, mind you, at least so far, long the chief author and sponsor of the single-payer-based Minnesota Health Plan in the legislature. Senator Marty chairs the Senate Energy and Environment Committee, but also sits on, and once chaired, the Health and Human Services and Housing Committee. Senator Marty, good to have you back on TTT.
Glad to be with you, Andy.
And we also have with us Aaron Anderson, who has served as both a board member and now the executive director of Healthcare for All Minnesota. Ms. Anderson, welcome to Truth to Tell.
Thank you.
Glad
Welcome,
to have
Aaron. Michael Milligan introduced himself through his work at the top of the hour, but we'll get him to break character long enough to get a sense of why he takes this show, Mercy Killers, all over the place and presents it at no cost to audience members. He's a Juilliard School graduate and has performed both on and off Broadway, as well as on stages of all kinds of coast to coast. Michael Milligan, thanks for joining us today.
My pleasure. Thanks for having me.
A pleasure to have you.
Sorry, just
Remember,
trying-
that's all right.
Trying to assess if our phones are working. Before I say that, are our phones working? Looking for. Yes, I'm getting
All
a
right.
thumbs up. All right, so you can call and join the conversation about single-payer systems versus the theoretical promise of the Affordable Care Act. The number to call is 612-341-0980, 612-341-0980, or tweet us at TTT or post your comments on Truth to Tell's Facebook page, facebook.com/truth-to-tell. I believe Craig, if you're watching online, Craig's usually posting those links on the video.
That's right.
as
He
well.
sort of puts it there in the window.
Right
Well,
on the
John
screen.
Marty, why isn't Obamacare enough for all these after all these years of your sponsorship of the Minnesota Health Plan? And was it a little disappointing to come up against the Affordable Health Care Act?
Well, the way I take it is that the Affordable Care Act, the couple of things it did. One, it covered more people, provided health insurance to a lot of people who have nothing. And that's critically important, makes a huge difference in people's lives. And the other thing it did was it said for the first time we as a country intend, I mean it didn't do it, but it said we intend to cover everyone, make sure people have health care. The trouble is what they end up doing is trying to give health insurance to more people, and that's a fine thing to do, but what I'm more interested in is having health care for everyone. And the analogy I'd make is to police and fire protection, other public needs. We all need police protection. We don't know how much. You may need 1,000 times more than me if you're in a dangerous situation or something. Fire protection, same thing. But unlike those two things, healthcare is something you got to shop for and hope it works, and now we're setting up this huge, complicated insurance exchange in order to help people shop for insurance instead of help them get to the doctor or get to the dentist or get to the chiropractor, whatever help they need. So I think we got to change it around. And And the way to carry that analogy one step further, if you go home today and find your home's being burglarized, you call 911. I don't care where you're calling from, what community, anywhere in Minnesota, frankly, anywhere in the country. You call 911, say, my house is being broken into. I'm sitting out in my car talking to you on my cell phone. And the one thing you won't hear from the police dispatcher is, well, do you have police insurance? Does your policy cover home burglary? How are you going to pay the copay? They don't ask that. They come and they help you, and they help you as fast as they can, and they do the best they can. Why can't we have health care the same way? That's what the Minnesota Health Plan, that's what single payer is all about. Just making it that simple. When you need to go to the doctor, the clinic, the hospital, the pharmacy, you get the help you need. We don't spend the time worrying about who's paying for it because it's cheaper if we all pay for it together.
Aaron, talk about Healthcare for All Minnesota, which I had a different name once before, the MUHC, I believe it was, right?
MUHCC, yeah.
Yeah, right. The Minnesota Universal Healthcare Coalition. Now called Healthcare for All Minnesota, which makes sense, sort of, because a lot of the pitch has been, well, we really need a Medicare for all, don't we?
Yeah.
Is that what you've been talking about?
Yeah, just getting rid of that word 65 out of the Medicare bill. That would be great. If we could just get everyone covered, it would save money, and no one would have to worry about the copays and what doctor is in your network, and do I have the money? Is the deductible, how high is the deductible? You'd be able to actually get the care you need when you need it.
So we know this. Why is Obamacare not fulfilling this role? I mean, there was all this filling the gap of about 50 million uninsured people across the country, and what, about 500,000 in Minnesota, something like that?
Close to 500,000 in Minnesota. Well, I think Michael's,
Probably over now.
the clip you used from his drama, talking about, well, his wife was insured, did have cancer, and so what's the problem? Well, the copays, the deductibles, the excluded things, that's what's bankrupting people. And so in Minnesota, we had, prior to Affordable Care Act, we had 92% roughly insured. But so forget those 8% who aren't insured. Some of them will get covered under Affordable Care Act. But for the other 92% who had insurance but can't afford the copays, can't afford the deductibles, can't afford things like dental care if it's not covered, it doesn't do anything to change that. And so the trick is to say, hey, it's good, it's doing some good things, but it's not sufficient. And, it's not like we're competing with the top countries in the world on this. It's not just Germany, France, England, Japan, and so on. It's Taiwan and Turkey and Poland, what we might have used to call second world countries. They all provide health care to everyone, and we can't in Minnesota.
Is that right? Even those second tier
countries, they provide health care to everyone, and we can't provide it to everyone in this state, in this country. I mean, it's a shame.
But we are talking about what people literally say over and over again, a political impossibility under the circumstances of today's climate in Washington or even Minnesota. Here we have all Democrats.
Andy, 5 years ago, I introduced a marriage equality bill in Minnesota. I think some people said they thought it was from another planet. Ain't going to happen in my lifetime. I heard lots of people say that. 5 years later, it happened.
Yeah.
We're saying the same thing about Minnesota health plan now. We have to make it happen. People are dying. I mean, literally dying from lack of health care. Even will continue to under the Affordable Care Act. Yeah, it won't be that simple because they didn't have anything. It's because they didn't have something. Well, then they found out they could qualify, but by then it's too late because the cancer spread or something else. People are always going to be dying. Even with a perfect healthcare system, we're all going to die. But people shouldn't be dying because they have a lack of health care. And, so if it's politically impossible, let's start talking about the fact. Let's throw out what's politically feasible or not and start deciding that something's the right thing to do. Let's do it. That's what we did with marriage equality. Let's do that with health care.
Michael Milligan, you set up your character to be pretty much surprised by the lack of coverage that wound up coming down because of the cancer that you talked about. How did you come about in creating these characters, and what inspired the development of this plot, as it were? It's hard, you do have a plot, but it's a one-man plot, and it's sometimes people say, well, my gosh, that's the most effective way to do something, isn't it? Go ahead. Tell us the story.
Well, when you work in the arts, you inevitably, either you or close friends who are also in the arts, wind up facing some kind of horrible situation with lack of health care, because artists tend to be one of the groups of people who are marginalized. So I had a situation where I was in a relationship for a number of years with someone who didn't have health insurance and needed health care. And then on top of that, one of my dear friends who was at Juilliard with me, a fantastic actor. Before he went to Juilliard, he studied opera at Boston University. Very competitive program. One of our finest Shakespearean actors of my generation.
Really?
He performed at, many of the really top theaters in the country. And he had a little bit of a situation where he ended up living on the street. And he showed up at the stage door. I was doing a show in D.C., and he had a little sack with him, and he was homeless. And we all lost track of him for a year or so. And I took him in, and they had him on some medication, the court system. And he
was this a mental health issue?
Yeah,
Okay.
mental health issue.
All right.
And so they had him on some kind of horse tranquilizer, it seemed like. Basically, I took him in, and then was confronted with, what do I do with my friend? And he, in addition to dealing with his mental health issue, he had developed this really scary-looking lump on his arm, and he'd also slipped a disc in his back, and he was living on the street. And so I took it on. I brought him to stay with me, and then I discovered how difficult it is to get medical care for someone in that situation. This is in D.C., and John is an African-American guy, so that was another strike against him, unfortunately. In D.C., he just became another black guy living in D.C. on the street. And so what happened was I called the homeless clinic, and I was trying to set up an appointment for my friend, and we came up against this very Kafkaesque problem of a requirement for proof of homelessness.
Proof
if you
of
can imagine,
homelessness.
which, what is that? A hole in your shoe or something?
Yeah, yeah.
And so this, it just introduced me to these labyrinthine hurdles that you got to go through and he's in no condition to surmount those hurdles on his own. And so that was another thing. And then the final thing was, last spring I found myself without insurance for the first time in my professional life. And 2 weeks into that, I started passing kidney stones. I didn't know what it was. I was in the middle of a play reading. I actually had to get up and leave. And I went home, and in the middle of the night, after, taking some Tylenol, I said, okay, this isn't a normal situation. So, and this is what happened. And I think some of our listeners will be able to identify with this. I crawled across the floor to the computer, and I started doing my online Google diagnosis because, as you do,
Yep.
pain, kidneys, blah, 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 nausea, excruciating, blah, blah, blah. And of course,
We know all about those
diagnosed myself with kidney failure.
Oh, really?
So then, and then you can die, all this. So then the next Google search, and people probably can identify with this too, how much will it cost me to go to the emergency room? How much will an ambulance cost from Jersey City? $8,000. Oh boy, $8,000. Okay, 3% chance of death, 100% chance of $8,000. So then you do this horrible actuarial, accounting with yourself of, well, I don't know, maybe I'll just tough it out. And I think a lot of people, that's what we do. We tough it out, And so that was sort of the inspiration. I wanted to write something that addressed these things and did a lot of research.
So is your character a sort of an agglomeration of all the friends you've had that have gone through this?
Including
your own kidney failure.
Well, a lot of the underlying emotional content, some of it comes from my experience. Some of it is, I'll take some poetic license. I read 8 or 9 books about the system. I interviewed people. So, and also I'm from Ohio, and the character's from Ohio, so it's sort of honoring some of my kin, and who are wonderful people, live out in the country, self-reliant people, and that's what the play explores, is this tragedy of this noble thing, which is a self-reliant, individualistic outlook that has its limits, and so the play...
And the limits can be fatal.
The limits can be fatal, yeah. I did a performance of this in southeastern Ohio, where the play takes place, and some local people organized the show, and I got into the car, and this dear old lady, wonderful activist, a local saint, Arlene, she says, "Wow, it's so great that you're here. Last week, Mr. So-and-so, this old member of the community, he was diagnosed with cancer, and he went out into the woods and shot himself."
Whoops!
Because he didn't want to burden his family. He didn't want them to lose their house
and he
and their
couldn't
land.
afford treatment.
No,
I take
no.
it.
And I don't know if there's as many cases of things being that extreme, but of your earlier story talking about weighing, being able to go in and get diagnosed for this excruciating pain versus, knowing that you're going to have this huge bill to pay. I'm sure there's lots of people, even listening today, who can identify with that. I know personally I haven't had insurance for over a year, and I've definitely been in some situations
You
like
don't?
that. I don't.
Whoops!
No. I'm 27. I aged out. Thanks to Obamacare, I did have insurance for a little while longer because I think I was 24 when that got passed, so it did extend my coverage for a little while longer. But then at 26, I aged out and haven't been able to find anything that I can afford since. So, I mean, I totally identify with
hear,
that.
What you said about, there are a lot of situations that aren't as extreme as that. And I know the story I just told sounds extreme. Unfortunately, when I do this show, people come up to me after the show and tell me their stories, and that is not extreme. It happens all the time, things like that, and every story has its own unique nuances, but there are extreme stories that happen. I was up in Duluth last fall, and the pastor of this church told me the same story about someone committing suicide because of their medical bills, which is just
And
awful.
of course, if it's not committing suicide, it is bankrupting people, is it not,
Yeah.
John?
And that's why the whole analysis you go through when you self-diagnose at 3% chance, you think of looking at the computer what's going to happen. But it's not just amateur people doing that. I mean, we had a story a couple years ago, again, working on this legislation. I get the same sort of people coming up to you after a presentation or something, and I met a woman a couple years ago who lost her sister, 48-year-old registered nurse, lost her job in the recession in 2008, and with her loss of job, she lost her health care, and she had some problems inside. She didn't know what was going on. She put it off going to see the doctor. Brother finally brought her in 2 weeks later, and she died the weekend after it from thyroid condition, totally treatable just by pure medication. It would have been a very simple thing to treat. She's a 48-year-old nurse, and she misdiagnosed it, and you don't go in because you can't afford the ambulance ride, you can't afford the emergency room, you can't afford even the doctor visit.
You can't afford the emergency room? Don't they have to take care of you?
They have to take
They
you,
have
but
to
you
take-
have to pay for it later.
Exactly.
Oh, it comes later.
You get the bills, which is why you
Of
get the
course.
bankruptcy, and people like Michael, like this nurse named Laura, they make those gambles. In Michael's case, it worked out okay. In her case, it didn't. It's just a crapshoot of what happens. I mean, it's just luck. Bad luck for a lot of people.
That's Senator John Marty. We're comparing the Affordable Health Care Act, or Obamacare if you wish, with that other health plan that will not go away, single-payer health care, despite claims that people and politicians will not buy into its premises. Our guests this hour are giving us the reasons why it should, must end up as the only viable plan for universal and affordable coverage. Our guests again are Senator John Marty, State Senator John Marty, who once chaired the Health and Human Services Committee in the Senate. Sorry, John. And now sits on that committee because he chose to to chair the Energy and Environment Committee this year. But and Aaron Anderson, who's executive director of Healthcare Minnesota.
Healthcare for all Minnesota.
Healthcare for all Minnesota. And if for all is important in that name, of course. And Michael Milligan, performer and creator of his one-man play, Mercy Killers. We will be coming back in a moment. But
yeah, stay with us, and please, again, join the conversation. 612-341-0980 is the number to call to get your questions and comments live on the air. You can also tweet us at TTT Andy Driscoll, or post your questions and comments on Truth to Tell's Facebook page, facebook.com/Truth to Tell. Watch us live on livestream.com/Truth to Tell MN, and stay with us. Truth to Tell will be right back.
So then you just go through the pile of bills that you can't pay, and you pick out the one with the immediate gun to your head, and that's the bank. Yeah, I mean hospitals, they're all used to getting stiffed. You know, they all got to take that hypocritical oath. But the bankers, they don't mind pulling the trigger. I mean, look what they did. They all got on the phone with their cronies in Washington, and they threatened to nuke the whole world if we all didn't pay them back the money that they lost at the roulette table. And Bush paid them, Obama paid them. Yeah, the bank, they get what's coming no matter what. Listen to me, my conspiracies, I don't know. Well, I do know that that's where all my energy is going, you know, and there's a light 10 to 15 years down the tunnel, right? That we're climbing out, and that's when it comes back. Round 2, yeah? So it takes $400 for the doctor at the hospital to tell us, of course, we got pay up front for the news because our credit is run out at the hospital. She needs the tests, man. She needs the treatment. But the credit is running out everywhere. So I found this one old card that I haven't used yet. It's got a $4,000 limit, and that's just enough to pay for the news that she needs a double mastectomy. Yesterday, I can't possibly pay for that now. Everything I earn, it goes to the mortgage and the medical debt payment. I could never pay for that anyway with what I earn. In the hospital, they want it all up front. So that's when the administrator at the hospital asks if we're eligible for Medicaid. That's a shock to be in that boat with people taking a handout. But man, that wouldn't have worked anyway because you know I make too much money to qualify because you know we are in the middle class. And Jane and I, we don't fight really, but we did get into it over that. She said that I should just work part-time, or worse, just lie about what I made so we could meet the income cap. It makes me sick to my stomach. But that wouldn't have worked anyway because, you know, they're looking at your back taxes, and I'm the only small business owner in the country who pays them all. So after the fight, I'm sitting there with the application. I see what we got to do. Yeah, I'm the reason that she can't get Medicaid. They use your shared income for the cutoff. So if I'm not in the picture, yeah, the only way I can take care of my wife by getting a divorce. Yeah, without me, they're gonna fast track her through to Medicaid, where we read on the web. But breast cancer coverage pretty good. Actually, got a new program, breast cancer. You go get screened, and they fast track you through treatment on Medicaid. But you know that program, you know, is only good for women 40 to 65, and Jane is 35. I don't think that she can wait 5 years. So we got to get in through that low-income eligibility. So we go ahead, we file for a divorce. And then you got to still wait 90 days. Well, that's a lot of fun, fellas, let me tell you. Sitting around knowing that these things are growing inside of your woman. There's nothing you can do about it because you're just too poor. Every day could be the point of no return, you know, like the tipping point where it's too late and we shouldn't even be here because we paid our share. Of course, Jane, you know, she's trying, you know, this diet thing that she read about online, you know. Yeah, she's on a crusade. She's gonna fight it with garlic and peppers and breathing. How's that? living here. Most advanced civilization in world history, trying to beat back cancer with a clove of garlic, a bottle of Tabasco sauce.
Once again, Michael Milligan from his one-person play, Mercy Killers. Michael, thanks once more.
And welcome back to Truth to Tell. I'm Michelle Alimoradi.
And I'm Andy Driscoll. Back to our discussion about the single-payer health care in light of the Affordable Health Care Act.
Still time to call us and join the conversation at 612-341-0980. 612-341-0980. You can also tweet us at TTT Andy Driscoll or post your questions and comments on Facebook. And I think, do we have a comment right now? We do. Yeah,
Yeah.
and she's on the phone. Valerie from Minneapolis. has a
Valerie's
comment. Let's
all
go ahead
right.
and bring her on.
Valerie, good morning.
Good morning.
Talk
Good
to us.
Hi. I have a lot of opinions on this subject. I worked at a hospital for 25 years, and my mother had worked at a hospital for 38 years, all of my life. And initially, I was on medical assistance for a while, the best insurance plan I ever had. Things were covered that you needed. You didn't have to worry about it.
Now,
And then I was-
that's sort of Medicaid in Minnesota,
It's
isn't
Medicaid in Minnesota,
Yeah.
medical
That's
assistance.
right. Okay, go ahead. Go
And
ahead,
it was
Valerie.
really a good plan. And then I worked at the hospital, and initially, back 25 years ago, it wasn't too bad. The co-pays were only $7, but that was for the doctor visit and the prescription. And sometimes if everybody was sick at the same time and you had to pay all of that, that seemed expensive. But I had no idea how bad it was going to get. Towards the end there, with the deductibles and everything, I one time had such a bad lung infection that my manager, my nurse manager, was saying, "Oh, you sound like you have pneumonia. You really need to go in." And I said, "I can't afford to go in." And she said, "Don't you have insurance with us?" And I said, "Yes, that's why I can't afford to go in." I mean, I can't afford to pay $300. That's half my check. I can't
Wow.
afford it.
So the
And
deductible
so-
was enough, or the copay was enough to break you that week, or
Yeah.
And this was on
It would've-
employer insurance, right? This is after
Yes.
medical assistance.
And we
Yeah,
actually,
no, medical assistance was perfect.
we
I
have
mean, you
a,
did not have to worry about it.
we have
If
a,
you were
vo-
sick, you went in.
Thank you, Valerie.
right.
Let's hear from Erin about that. She's Minnesota Healthcare
Aaron
for
Anderson
All.
is going to respond to you now.
yeah, and I'm actually a Maple grad as well. So
Are you?
Yes.
Ah, good for you.
But yeah, I mean, the deductibles are horrible. There's we have a volunteer who works a lot with us at our organization, and Healthcare for All Minnesota is really the grassroots organization behind the single payer movement. And we have a volunteer who's actually on the MCHA program, the state program for people with pre-existing conditions, and she has a history of breast cancer, and she has a $10,000 deductible.
Whoops.
Yeah, and so she cannot go in for her annual mammogram because she cannot afford to pay that $10,000
Then why do they
deductible.
pay? Why do they even pay premiums into a plan like that if they can't afford the deductible or
It's-
the copay?
It's
Why-
that if something, a car accident, it's that catastrophic care
You're talking
coverage.
about the stuff that's going to cost you like $200,000-$300,000
Yeah.
is what
Right.
you're preparing
and they
for.
still have
Yeah.
to pay the 10,000 though, right?
Yep.
How do they do that, John?
People don't. That's my trouble with health insurance. That's why we have to have health care. I mean, this is nuts. I mean, you can't make any sense out of it because it doesn't make sense.
Well, and
The Affordable Care Act will help, but it's still going to be, as Valerie said, when she was on medical assistance, it was okay because then you don't have these huge co-payments and so on. That's what our Minnesota health plan will do, only it'll do it for everyone. And get rid of the insurance, just make it so you have health care.
you're
And-
chomping at the bit,
And
Erin.
there's a shocking statistic that that we've gotten from PNHP is that 78% of bankruptcies in this country are caused by medical debt, but of that 78%, 62% of those people had health insurance when they got sick or injured.
Well, let's talk about that.
78%
Of medical debt is
of all bankruptcies.
all
though.
bankruptcies.
And let's talk about that because part of this new part of Obamacare, the Affordable Care Act, is that going into this, as we move into 2014, you are supposed to, correct me if I'm wrong, qualify for subsidies if health insurance is going to cost you more than 10% of your income. Is that it, or 9%?
It depends on what your income is, and so that's the trouble. When you try and figure it out and try and explain it to people, that's what freaks people out too. I mean, it's difficult enough getting people to go to the doctor when they need to go. When they know they can't afford it, that makes it they don't go. And when you say, well, you can qualify, but it'll be this much, and your copay will be this, and your deductible will be this, but if your income's this, and if you qualify for this, it just freaks everybody out. When you're struggling with a health issue, they just can't handle it.
Yeah, and you know, for me, like, I don't have health insurance at all, so I'm not paying anything at this point. So then if I'm then suddenly forced to pay something that's somewhere around 10% of my income, that's a pretty big new expense that I have,
You'll
every
find
single
that
month.
out in the next few months.
Yeah,
Yes.
so that's exciting.
So this all has to happen by October, right? Is that correct?
People will have to have insurance by January 1st. The health insurance exchange will be online by October and so on. And again, this is a touchy thing to say because it's a lot better than it was a couple years ago.
Well, that's why I wanted to bring up these comparisons.
Why don't we
because,
fix the system instead of
I mean,
tinkering?
but aren't the people going to say, look, this is subterfuge to talk about single payer right now in the face of the fact that there's been this massive effort to cover people better.
But it doesn't fix the problem, and people still will die from it. They'll still go bankrupt. They still won't qualify. That's the trouble. I mean, the Affordable Care Act is a step forward, but it's way too small for what we have to do, and it doesn't bring down the costs. Everybody's still going to struggle with the costs.
Why did they run away from the so-called public option, do you think?
Well, I don't think public option would have been one more insurance option, but bottom line is we're paying for this very expensive healthcare system. We spend twice what any other country spends on healthcare, and we don't get the results. And that's why we have to I just say, let's remove the health insurance. Insurance is good for homeowners, it's good for auto stuff, it's good for other things, but for healthcare, which we all need, and it's a life or death matter, let's get it out of the picture so when you're sick, you go to the doctor.
Michael, you
Michael?
had a comment?
I just wanted to mention that with the
This is Michael Milligan, by the way.
Michael Milligan, yes.
Yeah.
on the exchanges, there are some good rules. For example, they will have a limit of how much you can owe annually, right? Which is
So
great.
how does that work?
What do you mean, oh, whom?
Owe for your medical care.
Oh,
There'll be a limit.
You're out
to
of
how
pocket
much-
and everything.
So
They'll
that's
have
sort of
limits.
like a deductible almost? I mean, are we talking like,
No,
so I
if-
owe $12,000?
No. If you have some catastrophic situation,
Yeah.
there will be a cap on how much you will have to pay annually. If you're on one of those exchanges. Now, to be on the federally subsidized one of those insurance things, though, you have to make less than a certain amount. So again, the people who will be or might be more exposed are people, the working, what we call the middle class. Those people will not be eligible for those kind of insurance that have that cap of what you can owe.
And that's something that
And-
you brought up in your piece earlier. There's a lot of people that sort of fall into this cusp where they make too much money to qualify for, say, what Valerie had, the medical assistance that she thought was
Yeah.
great. And they might be able to get insurance from their employer, but it's
Well, what
you
if
know,
you have your own
yeah.
business or, you're
Yeah.
self-employed? Or,
And that's what it sounds like this character of yours
Yeah.
does have. I
Yeah.
mean, it's his
and
own.
isn't that the American dream, that we
Yeah.
start our own business and
And
make
that
our
is
own
the
way?
that's one of the biggest problems in this country is that the small business person, the independent operator is the one often suffering the most. I know. I was there. If I hadn't been covered by my dear wife's coverage at the state of Minnesota, I'd have been a dead man long before this.
And I want to say that the Affordable Care Act will take a lot of the lower middle class folks and will cap deductibles. You'll be better off buying if you have to buy coverage on your own through the insurance exchange because the policies, the $10,000, and there are $15,000 deductible plans. Greater Minnesota farm communities, often people buy things like that. They won't. The plans under the exchange will be better than that, and they will have caps on the copays and deductibles. Still too high for a lot of people, but it'll be a lot less bad than it is now. So in other words, let's not describe it as great. Let's describe it as less bad than it is now. And a lot of people, like Michael's character, may be helped. You can't know until you see how it plans out in any state.
And Senator Marty, as we were talking about before, Physicians for a National Healthcare Plan, when we had them, or Health Plan rather, Minnesota, when we had them on our show in March, had brought up that, although this isn't entirely single payer, that moving towards this MNsure, having this infrastructure set up, is advantageous to moving to a single payer plan. Do you agree with that?
I'm not sure. It's hard to tell because bottom line is we want to replace the insurance companies with just direct health care.
And so this is sort of I don't have to deal with it today.
Yeah.
We can do that tomorrow now.
That's the fear is. And again, my point is not to bash the Affordable Care Act because it does help. And anybody who's helped by it, it can be a life or death difference.
Well, and it gets the conversation started, does it not?
It certainly
in a way
gets the
that it hasn't been
conversation
before.
started. But
Aaron?
And there's also opportunity within the Affordable Care Act to apply for federal waivers for states to start enacting their own systems. And I think that's one of the things that really allows for us to see kind of the light at the end of the tunnel for a single payer system is that, the Affordable Care Act did work in ways for states to do their own thing, and that's where we're really aiming for is that we can enact this Minnesota Health Plan here in Minnesota, apply for those waivers, and then have our state-based single-payer system. And
do you think that politically it can advance in that kind of ways, John? I mean, you again, I know that you've always been out ahead of the game on so many pieces of legislation, and yet you're not always given credit for that. The credit comes later with other people involved. This often happens to a leader. But talk about, on the one hand, you see this as sort of a procrastination move if you have the Affordable Care Act or Obamacare, you can somehow postpone any consideration of getting rid of the insurance. And that's a powerful lobby, that insurance company.
Insurance lobby, pharmaceutical industry.
Yeah.
There's lots of powerful lobbies against it. They have a lot of clout. The health plans in Minnesota, the insurance companies have a lot of clout in Minnesota. And so, hey, the odds are overwhelmingly against it. There's no way it's going to happen. Of course, there was no way marriage equality was going to happen either. Of course, there was no way civil rights was going to happen. Of course, there was no way women's suffrage was going to happen. It has to happen.
Yeah, I like these comparisons that you're making because it's true. About 5 years ago, would anybody have thought that we were going to pass this marriage equality bill well, I wouldn't say easily, but so quickly? And you're right.
I had people act as if I was another planet for introducing a bill on it.
And I think you're right that so many people feel like this is sort of a pipe dream.
It has to happen. That's the whole point. It's killing people. It's bankrupting us. We can't afford to keep doing this. Our Minnesota health plan, if we put it into place, we think the $40 billion a year that Minnesota, not the state, but people in Minnesota, the government, employers, individuals, families, $40 billion we spend on health care. We think we'd spend about 25% less. That's $10 billion per year less. That's what we'd spend if we passed Minnesota Health Plan, which is why we have to do it.
Okay, so Aaron, talk about what's going to be happening this Thursday, would you please? Because that, I think, and then everybody gets to see Michael's entire performance live.
So this, we have our annual fundraiser. It's the Healthcare for All and PNHP put it on. It's the single-payer summer celebration.
And PNHP, again, is?
Physicians for a National Health Program.
There you go.
And so we're lucky enough to have Michael come back to Minnesota and perform Mercy Killers, and we're going to be at the Chanhassen Dinner Theatre. For people who missed the registration deadline, we actually have extended it now for people who just want to see Michael Milligan's performance of Mercy Killers.
But dinner is out.
Dinner is out. We had to get the number to the caterer.
Yeah,
Sorry.
The caterer wants to know how many are going to be eaten.
But if you would like to come down to the Chanhassen Dinner Theatre and see Michael's performance, you can go to our website. It's HCA-MN.org, Healthcare for All Minnesota, and you can check out the link to purchase tickets. There is on our website.
Okay.
Is it on our website as well?
I believe that, yes,
I think
it
it
is.
is. Yeah.
Right.
And it is our annual fundraiser, so we are asking people to pay $30 to see the performance. And so, it's going to be a wonderful night, and we're really excited to. This will be my third time seeing the show, and I hear it just keeps getting better and better. So.
Well, and it's a powerful piece of playwriting and performance, Michael.
Thanks.
You've been just great.
Thanks.
It's been good to hear you. We must end it there, thanks to all three of you.
Yes, we've had DFL Senator John Marty of Roseville. Glad you could come back and be with us. Always nice to have you.
Thank you.
Always good to have you, John. Aaron Anderson, Executive Director of Healthcare for All, Minnesota. Thank you. Well, it's best wishes for a good celebration this Thursday.
Yes, and that celebration will feature Michael Milligan's Mercy Killers, his one-person play, as we've been talking about all hour about healthcare. Michael, thank you very much for being here and
Thank
performing
you.
for us today.
It was easy to get sort of carried away by your performance.
Oh.
It really was.
Thank you very much. Okay, so much of the success of any plan depends on how well you take care of yourself at this point, your family, and, by the way, your community. It seems logical that a single-payer system would benefit Minnesota and all citizens the most, but if you agree, you'd better tell your legislators that who are, to get on the stick and pass the bill. Once more next week, we repeat the audio version of our UMD appearance, that show on sulfide mining up at University of Minnesota Duluth. Don't miss that. Even if you've already have, you can listen again.
Yeah, listen to it like 5 times. It only gets better. No, Truth to Tell is a co-production.
But don't watch it. I look terrible on camera. All right.
No, please do watch it. It's great.
It's good.
We want to remind you, Truth to Tell is a co-production of Civic Media Minnesota and KFAI. Links to audio and video archives of this and all of our past shows are up on Truth to Tell's own website, truthtotell.org, as well as a few weeks past on KFAI.org and the KFAI mobile app.
Yes, indeed. And Mark Kerner engineered this week's show. Peter Hansen assisted him in there. Craig Stelmacher is our videographer. And and this program will be on Truth to Tell soon online.
Yes, and stay with us. We'll be back again next week with another edition of Truth to Tell. Until then, I'm Michelle Alimoradi.
And I'm Andy Driscoll. And remember, as always, please do take care of each other.